Begin. Welcome everybody to the Let's Talk COVID-19 series. This series is organized by the Kenya Registered Nurse Anesthetist Chapter, which brings together all nurse anesthetists working within the boundaries of our country, Kenya. We are a chapter that is registered under the National Nurses Association of Kenya, who have graciously provided this Zoom platform to have this call. So the Kenya Registered Nurse Anesthetist Chapter is responsible for advocacy, continuous professional development and research on behalf of the nurse anesthetists in our country. And as members of NNAK, we are committed to their mission of excellence in nursing and midwifery. The KRNA chapter is also the host of the Pan-African Nurse Anesthetists Conference, which was to be held this year. But because of the COVID-19 outbreak, we have postponed it to 2021. So we will be having some of our panelists speak a little bit about this conference and how you can get involved in the same. So this is the 6th episode of our series, and today we will look at the role of anesthetists in the era of COVID-19. We have a good range of experienced anesthetists as part of our panel. Our chief speaker will be Dr. Jackie Rolls, who is the president of the International Federation of Nurse Anesthetists. Joining her on the panel are Jill Eloy Ribuka from Burundi, Mary Mungai from Kenya, Donnell Carter from the US, and Susanna Anang from Ghana. So I'm hoping that you will really enjoy this session, and please use the Q&A box to ask any questions that you might have during this meeting. We shall try to answer them at the tail end of this talk if time allows. So just a brief on why we are focusing on non-physician anesthetists, just to give you a feel of our numbers. So in 2017, the World Federation of Societies of Anesthesiologists conducted a workforce survey. And in their study, from the statistics that they took for Africa, they found that 38 countries in Africa had reported to have non-physician anesthetists. So those are both nurse anesthetists and other cadres of clinicians who might not be doctors. And these non-physician anesthetists represented more than 50% of the workforce in 33 African countries. And that's a very significant portion. And if you look at the map that is on your screen, you'll see Africa is red, meaning that we have, in many of African countries, we have less than one physician anesthesiologist per 100,000 population. So we are way behind the acceptable minimum of 5 per 100,000. And this inadequate anesthesia workforce is one of the contributing factors to the inability for 5 billion people to access safe surgery and anesthesia in the world. And the WHO has declared that surgery should be a part of the delivered services under the universal healthcare coverage. So we have a long way to go, and we are happy to use this forum to represent what nurse anesthetists are doing in the world. So we were to have our president from the National Nurses Association of Kenya join us for this meeting. He is held up somewhere and he promises to join us if he is able. You understand the norm when you're doing clinical work and other duties, it's not always possible to make time. So if he's able to join us in the course of this meeting, he'll give us a few words, but I think we can go straight to the panel presentations. So I'll introduce our first speaker, who is Dr. Jackie. Um, give me a minute. So just as a form of introduction, Dr. Jackie Rolls is a well-known leader within the United States and internationally. She's an associate professor of professional practice and the director of Advanced Pain Management Fellowship in Texas Christian University School of Nurse Anesthesia. She has held various leadership positions. Currently, she's the president of the International Federation of Nurse Anesthetists, and this is her third term. She has also been the president of the American Association of Nurse Anesthetists, served on the board of directors for the American Academy of Pain Management, worked as a board member in the Nursing Organizations Alliance, and served as the treasurer in that organization for about 3 years. She also served on the board of the G4 Alliance, which brings together organizations that are interested in pushing forward the agenda of safe surgery and anesthesia in the world. She serves as a member of the Ball State University College of Health Advisory Board and has been honored with various leadership and service awards, including the 2018 Hammy Lonhart Award for Outstanding Global Leadership and Education. So we look forward to hearing from you, and I will hand over to Jackie to take us through the next stage of this presentation.
Great. Well, thank you so much for having me today. It's always a pleasure to get out and be able to lecture a lot of places. And with COVID-19, more and more is going on with Zoom. So thank God for Zoom so that we can all stay together. Today, I want to take a few minutes and talk about what the International Federation of Nurse Anesthetists, or IFNA, is doing to advocate for nurse anesthetists all over the world for our recognition, for education, and increased access to surgical care. And then I'll be happy later to take questions. We can go to the next slide, please. Just a brief introduction to IFNA for those of you that aren't familiar with us. It started in 1989, and we were chartered in Tufen, Switzerland, when there were 11 charter countries at that time. Currently, IFNA enjoys more than, 43 member countries from 6 areas of the designated world geographic region, and we are very, very happy that we have the ability to have all these close communications. Although, as you know, face-to-face meetings have been delayed, so we're trying to conduct everything virtually. It takes a little more time, but it's still great. Next slide, please. What are we doing? What are our activities? Well, really everything we do and have been doing for 30 years is aimed at provision of safe and high quality anesthesia care to our public, whoever they may be, wherever they may be. We work to unite our members, share information and advancement among our countries so that we can help countries that are going through similar situations or challenges, and share successes with one another. That is a big part of what we do at IFNA. We assist those that have requests for information on our role. They don't understand in many countries what nurse anesthetists do or are capable of doing. They want to know what's our scope of practice. I get inquiries from ministers of health, from government officials, wanting to know exactly what we do, because honestly, many times they're quite confused about what a nurse anesthetist does. So we're constantly advocating for our profession. We've developed and shared standards of education and practice. As a matter of fact, the very first committee was a year after we were incorporated to do education and practice standards. So we worked on that very early in our history. We provide countries with model curriculum for nurse anesthesia educational programs, and they also have been shared with WFSA, so the World Federation Society of Anesthesiologists, at their request. I have shared this with them. So we have programs that are at the certificate level, the bachelor's level, and the master's level that are available to help meet educational quality guidelines, standards, and make sure that nurse anesthetists are receiving the kind of education that we need to be full service providers to our patients. We also started an anesthesia program approval process. We call it APAP, and it is an accreditation, a global accreditation of non-physician educational programs. And that's not been done anywhere in the world before. We were told by WHO, we were told by ICN that we are the only profession that has this type of global accreditation. And it's a 3-tiered accreditation because we know that one size does not fit all in every country. And then we're continually collaborating with other organizations to advance the anesthesia and safe surgery agenda. Next slide, please. We're trying to raise the visibility and respect for nurse anesthesia and all of nursing. That's a huge endeavor for us. We do that through collaboration with these many organizations and through participation, attending meetings, getting to know people. That way we have a contact when something comes up. We're working to increase access, as I said, and safety of global anesthesia care, and establishing and increasing communication among global nurse anesthetists is huge. I can't tell you the number of nurse anesthetists from multiple countries that have become friends, that send emails back and forth, that share information, and have said it's one of the best things that's ever happened to them. So every effort that we have is toward increasing access to care and the safety of anesthesia. As you know, and as the numbers just showed us that were presented, the manpower shortage is real, no matter what is said in different areas of the world. Let me address the benefits of global communication and cooperation in times such as these, when we have a global threat to us and global challenges such as COVID-19, which I think is only going to be the first of more to come, unfortunately. Next slide. So we all know, we heard when China first reported the disease and the virus and how it was spreading. By February then, just a couple months later, IFNA representatives were already active. They were sharing information, what was going on in their countries, first out of Asia, of course, saying this is what we're seeing in patient symptoms, this is what we're seeing that works for managing them, these are the challenges, this is what we're doing to try to protect ourselves. And when you have that many countries all over the globe in these geographic representation areas sharing information, I really believe it was a huge benefit for us. So we were learning about statistics from one another. You know, what is the incidence of this virus, and how many people have severe viruses versus mild? How many need to be airway managed? How many are dying? We were sharing case reports of things that happened. And I remember early on out of Europe when they finally were getting people off the ventilator, because in the beginning it seemed everyone going on the ventilator was pretty much a death sentence for a while. They got people off the ventilator, but then a day or two later they were losing them as they threw some sort of embolus, people that were sitting up in bed eating, speaking. So we learned more than we knew just by sharing, than we could have known on our own, especially in our geographic region, which it hadn't hit too much in that time in the United States. Personal protective equipment use and shortages. There were shortages almost everywhere immediately. So we had a lot of meetings to talk about what are alternatives, what can we do? Can you reuse masks? And if you're going to reuse masks, how do you do that? What is safe? Policies and procedures for cleaning, for disinfecting, for screening patients coming into the hospital, for allowing families to come. Everything was shared. Treatment, outcomes. Then any publications. I remember the day I got one from Japan, one of the early publications in a scientific journal about COVID, and it was in mid-March. Our rep from Japan then translated for us just a brief overview of that article and what kind of medications they were using, what was working. It was quite interesting and helpful. And then we started having Zoom meetings to help one another. Next slide. I want to talk about advocacy for nurse anesthetists and throw this in now because so many places I go globally, they talk about task shifting. And back in 2008, the World Health Organization had a report that encouraged task shifting, basically saying task shifting is taking something that belonged to one profession or one specialty and shifting it to another. So for example, for nurse anesthetists, we were told tasks that were physician anesthesia are being shifted to a nurse anesthetist because we need workforce optimization, however, or workforce needs. I want to say, and this is what I do say internationally, nurse anesthetists are advanced practice nurses. We plan and deliver an individualized anesthesia care plan, and this is to patients across the lifespan. It's not task shifting for us. We are educated to do this. Primary result of our nurse anesthesia education. So it is not task shifting. It is a task we have been educated to fill and to provide anesthesia. So we know our knowledge, skills, and competencies are very multifactorial, and we have expertise that can be utilized in non-traditional roles to provide patient care in multiple areas of need, which is exactly what happened with COVID. We were the pinch hitter, as we say in baseball. Somebody goes in to bat for someone that's maybe not as good or they have a need. We're that. We're the jack of all trades. We could work in the ICU. We can screen patients. We can work in emergency services in some countries at this point in time. Whatever needs to be done, pretty much we have the skills, the knowledge, the competencies, the teamwork ability, the communication to do it. That's really important right now when we are trying to take care of patients and there's a critical void in critical care providers with COVID. Next slide, please. So COVID-19 really has thrust nurse anesthetists into the limelight. And I'm hearing it from our country representatives that they're doing the same things. Everyone is playing all these multiple roles, from whether you're now managing an anesthesia ventilator long-term for a patient, to you're actually administering COVID-19 tests, to the intubation team you see on the right side of the slide that is intubating COVID patients all throughout the house. Next slide. We have leadership roles. We are leaders. We are leaders whether or not we are in a leadership role or not. We are entrusted with care of patients at such a vulnerable time in their lives. And we have to leverage that leadership outside of the operating room. So all of you, I challenge, if you're not, get on a committee at your hospital or place you practice. Volunteer to serve in your anesthesia association in a committee chair, an officer role, or on a committee. Just start helping. Serve as a researcher or an educator. You know more than you think you do. It doesn't always have to be a formal role at a university. Teach within your area where you practice. Even educate nurses how to, nurses you're working with, how to help you watch for trends and help take care of patients. And be sure to advocate for your profession with your policymakers. That's how they know who we are and what we do, is when we speak to them, not just at one-time event a year at our voting time. Next slide. We believe at IFNA that we need to work together for greater success. So our collaborations and partnerships are important to us, and it increases our chance of successful care of healthcare providers and our patient communities. Working with organizations such as the World Federation Society of Anesthesiologists. We've done a lot with the European Society of Anesthesiologists. You heard about G4. We work with Mercy Ships. We work with International Council of Nurses. A lot's going on right now with them as we are defining the role of the nurse anesthetist globally in writing. It's an exciting time. And the sharing of information and best practices among our team provides the best hope for the future. Next slide. As I mentioned, the International Council of Nurses, I kind of went over this already. The World Federation Societies of Anesthesiologists, they have a Congress. It just got canceled. Was in Prague. It'll be next year. And I am on a panel speaking about working together for success there. And then WHO has the Global Initiative for Emergency and Essential Surgical Care. And we work on that committee. And I mentioned G4 Alliance and Mercy Ship. I truly believe we're stronger together. And I believe that you all know that and believe it also. Next slide. So how do we affect what we call the anesthesia manpower tipping point? I'm actually talking about this Sunday during the United Nations Global Assembly. There's an anesthesia webinar being put on by G4 with WFSA and IFNA, and we also have a representative from the AANA speaking. How do we get to that tipping point where we now have enough providers, or we're over the tipping point and we can take care of the public? That's a hard one. We have to do it by working together with our anesthesia colleagues of all kinds to ensure that there's recognition, respect, teamwork, and optimal training of any and all anesthesia provider. Ensuring that all anesthesia team members are practicing to the highest level of their education, training, skills, and competencies is the only way we can increase anesthesia manpower enough to take care of our patients around the world. Next slide. So IFNA, two big things going on this year that I think will help us. We have a 30-year history book. We're in the final phase of editing it now. We should have it published the end of December. I have 42 of 43 country histories obtained. It's fascinating. I can't wait for anybody that wants to read it when it comes out, because it documents our presence, our role, and what we have given to these countries, to patients, when we didn't have physicians many times, or as a team with our physicians. And then the ICN and IFNA have a joint task force going on right now, and we are developing guidelines for the global nurse anesthetist. It will be done by the end of the year too, and it will be translated into 7 languages and shared by ICN. It defines us as an advanced practice role. It talks about education required to be a nurse anesthetist. It goes over scope of practice. And it is an ideal document. We know that it's going to take some areas years to reach that, but it's the ideal document of the nurse anesthetist as advanced practice nurse, which is quite important for our ministries of health and our government to know and understand that that's the level we are. And ICN will be a big help in helping to promote that. And they are who the governments and the ministries of health look to define nursing. Next slide. So let's work together, all of us, to move our profession forward. Next slide. So challenge yourself. I guess at the end, what I want to say is getting involved is wonderful. It gives you passion, it gives you energy. Yes, it's a lot of work, but you love every minute of it. You meet so many people, you can help make the world a better place. So take on a leadership role, even if it's a little uncomfortable for you itself. Step out of that zone. Be an advocate, be an educator. Maximize your education if you can and you want to. Share your expertise with others. We need to share it to make sure that we increase quality of care. You can conduct research, believe it or not, without it being formal research, something that you're doing on your unit. If you are tracking statistics on things, you can turn that into really research. It is research, and answer a clinical question. Something, why do we do this? Make sure it's still the best way to do it and share that knowledge. But really find a way to give back, because I think to all of us as nurse anesthetists, we have been given a lot. We love what we do. We want to help others and we want to give back. So this is me at the surgery center the last time I worked, with all of the protective gear. And we have these masks in the United States that have the anesthesia labels on them. I have to wear another mask over it, of course, since I bring it in from outside. But I just took a picture for my family that day and decided to share. Next slide. Is that it? I can't remember if I have one more. Oh, thank you. And I'll be available for questions anytime. And I can also, I'll go in the chat and put my email in for you also, if there's anyone that wants to email me privately. So thank you all for the opportunity to speak to you today.
So thank you very much, Dr. Jackie. I think we have a good challenge there to take up the banner and really advance the recognition of the non-physician anesthetists who work with us in Africa, especially in Africa, because I think even when they were counting the workforce, they really did, when they were mapping the density, they did not include us. So that means they still have a way to go in terms of making sure that they acknowledge that we are here and we are providing great service. So
exactly. I will tell you, I've had that discussion with the World Health Organization also, that the anesthesia manpower statistics do not include all of us. So hopefully moving forward, we can get that changed a bit, but we still need more of us.
Yes, we definitely do need more of us. So we will continue with our panel. I'll invite the second speaker. Let me just move. So our second speaker is Susanna Anang. She is an experienced clinician and medical educator from Ghana. She has trained in nursing, midwifery, and anesthesia. So this is truly her year. So for those who don't know, the year 2020 is the International Year of the Nurse and the Midwife, and Mrs. Anang is a true representation of all that is good with nursing, midwifery, and anesthesia. So she has 28 years of experience training nurses and medical students. She has held various leadership positions, including in the Ghana Association of Nurse Anesthetists. She's also been the African representatives on the executive committee of the IFNA, and she has a legacy career as an educator, taking part in training programs not only within Ghana but even abroad. She has been involved in the IFNA accreditation process for nurse anesthetist schools in Liberia. And this photo, in fact, is one from one of those exercises, and she's currently part-time faculty at the Accra College of Ghana. So I hope Mrs. Anang, you're still with us?
Yes. Can you see me?
Yes, we can see you and we can hear you clearly. So I'll hand it over to you to take it from here. Thank you.
Thank you, Katri. Thank you for inviting me, and thank you to all our participants. We are so grateful to have you on this our wonderful show. It's almost 4 o'clock here in Ghana, and as you know, Ghana is in the center of the world. Ghana is on the west coast of Africa, 4 degrees north of the equator, so we have a very hot and humid country. Ghana has a population of about 30 million, and currently we have 827 registered nurse anesthetists and 50 physician anesthetists practicing in the country. So you see the vast difference in the numbers of doctors and nurses working in Ghana. We, the nurse anesthetists, were the first to be trained in the country, and nurse anesthesia developed during the Second World War when they needed nurses to go to the war front to support the activities of the doctors who were there. So we had 11 people who were men, military nurses who were trained, and they were trained for 6 months in the 37 military hospital. Unfortunately, this program did not last because the doctor who came to train them, he had to go back to his country. In the 1970s, we had opportunity to join the University of Enugu because they had started a sub-region anesthesia program in the university. So we had opportunity of sending people there 2 at a time every 2 years so that we could boost up our numbers of anesthesia providers in the country. But this wasn't enough for us. Apart from that too, we had programs were mostly on ad hoc basis, usually for 3 to 6 months, and usually it occurred in the mission hospitals, mostly in the mission hospitals where we have missionaries from outside the country coming in from Europe and America. Anytime they came around, they said, nurse anesthetists to provide services for surgical care. Next slide, please. Yes, next slide, please. Formalization of nurse anesthesia training program. Thanks to the service of a British physician anesthetist who was sent. Yes, thanks to the service of a British physician anesthetist who was sent to Ghana to support the surgical service and anesthesia service in our new established school, medical school in Kumasi. That is the 2nd largest city in Ghana. So this man came and realized that he needed support of nurses and of people to carry out anesthesia service in the hospital. So he quickly set up the training school, and now we have we had the first formalized training school in the country. Currently, we have 5 schools in all. 3 are hospital-based and 2 are university-based, and they're all offering Bachelor of Science programs in nurse anesthesia. The training period is 2 years for the hospital-based and 3 years for the university-based, plus 1 year internship in any accredited hospital in the country after completion of the course. Next slide, please. The course structure. The schools were developed and established on the IFNA guidelines for starting a new nurse anesthetist program. As Jackie said in her program, that we developed those standards and of practice and education as soon as the IFNA was formed. So we had all those standards long before these schools even came into being. So we are thankful to the IFNA for all these standards that was given, and usually our curriculum is also based on the IFNA standards of education and practice. The length of program is 2 years for the hospital-based and 3 years for the university-based schools. And there's always a 1-year mandatory internship in any accredited hospital of the student's choice. And for anybody in this course, you have to pass a licensure examination by the Medical and Dental Board before being certified for a practice. Unfortunately, all the schools are being run by physicians, with the senior nurse anesthetists acting as course coordinators and clinical instructors. Regulation of practice is by the Ghana Medical and Dental Board. It is by the Ghana Medical Board because here we believe that anesthesia is a medical practice, and so the doctor said that no, they were not going to leave anybody. If we can't regulate ourselves, we have to be regulated by them. So they decided to regulate our practice. And the nurse anesthetists too were not ready for the nurses to be regulated, to regulate them because we know that nurses don't have any real background in anesthesia. So our practice is regulated by the Medical and Dental Board. Next slide, please. Sorry, sorry for that call. Somebody's disturbing anyway, so mute. The scope of practice. Until the year 1960, nurse anesthetists were the sole providers of anesthesia in the country, like I said. And then anesthesia, we have about 90% of anesthesia in the country being given by nurse anesthetists. And the scope of practice depends on the level of the hospital, whether it's tertiary, regional, or district level. Because the tertiary, they do all the different types of surgeries. The regions, you have them not doing so much, and at the level, they are limited. They are limited in their practice. We work under very little or no supervision. Very little in the tertiary hospitals, where we have the physician anesthetists. Most of the physician anesthetists, you find them in the tertiary hospitals. So that is where you can have some level of supervision. And for the regional, most of the regional and district hospitals, there is no supervision at all. Equipment, drugs, and logistics are mostly available, with only occasional shortages occurring. Usually for the equipment, unfortunately, we have problems with our anesthetic. Our machines are not so modern like you have in the developed worlds, and that we don't have any disposable laryngoscope, glidoscopes, intubation shells, breathing circuits, and these bags are all usables, and even filters are not common here at all. So it's difficult for us here. For IV drugs, most of the time, we have most of them, all the, except the inhalationals. Isoflurane is still our inhalational drug of choice, and we are yet to find our feet with Sevo. So Sevo is not common in Ghana here. Nurse anesthetists are only allowed to perform spinal anesthesia. Epidurals and nerve blocks are the preserve of the doctors. And almost all the emergency surgical services occurring in this COVID era are borne by the nurse anesthetists, exposing them to great risk of contracting the virus. Professional progression. Ghana became a member of the IFNA in 1992 and had a lot of support and educational benefits from them, as I said earlier. Access to professional progression is readily available through international conferences and local workshops and continuous professional development programs by the Medical and Dental Board. Visiting foreign lecturers and surgical teams continue to come in to offer various educational and practical support. We are very grateful to Kai Bele and the Duke University Hospital, as well as Jeff and his team from Utah University for their support. Now they are not coming, but I mean, they have done a lot for Ghana. Currently, the country has been zoned into 7 groups for easy accessibility and participation in workshops and CPD activities. Zoom meetings are ongoing to keep members informed and updated about what is happening in the world. All the 5 schools are in the process, they are currently in the process of developing a master's program. And Ghana is here to join the IFNA accreditation process. So actually, I assure you that maybe in the next 2 years, Ghana will be able to come on board the accreditation process. Challenges in the COVID area. Nurse anesthetists. Yes, this is Yes, let's go back to that Ghana. Yes, that's the state of our COVID state in the country now. At least we are not doing too badly. We have, as at yesterday when I checked, we had 564 active cases. And so far, the total number of COVID cases are 45,585. And then we have 54 currently new cases that we have. And then we have only 294 deaths. 44,797 people have recovered or have been discharged. And this is, I think we are grateful for that, because otherwise Ghana will be in serious trouble considering the logistics that we are far behind in. So we'll talk about some of the challenges that will be the challenges in the COVID area. Nurse anesthetists continue to offer valuable support in this critical area of COVID. Our members are among the frontline workers, even though the Ministry of Health is yet to recognize this true fact. Currently, there's even a proposed strike for Monday because the nurses and all the other allied health workers are not happy with the way the government is treating them, because the doctors have declared themselves as the sole frontline workers of COVID. And so we are yet to hear whether the strike is going to come on or not. A few number of our colleagues have contracted and tested positive and have recovered successfully from the virus. Fortunately, no life has been lost. The association has been very, very supportive of these people. And it's difficult to get numbers and numbers of people affected because of the stigmatization. So people don't want to come and act and tell you that, oh, I had it, I have it, or whatnot. So, I mean, it's difficult to get the actual numbers of people who have, or nurse anesthetists who have been affected by the COVID. But fortunately, all of them are recovered. Some of the challenges faced include, like I've told you about, is the same all over the world, increase in workload, yes, because the COVID brought an extra workload for us, because the anesthetists, we are the people who know how to do the ventilation and all this and the critical medical care. So nurse anesthetists were highly involved in the management and care of this current COVID cases and COVID era. And then we have insufficient or lack of PPE supplies, like all over the world. Fortunately, our government was able to charge industry to produce some locally made PPEs for us, so that at least we could save lives. But most of the PPEs are difficult to come by, especially in the district hospitals where the nurse anesthetists are. And it's difficult to test patients when they come, even for emergencies or even for emergency cases. So they're just working blindly on the patients. But thank God that most of them are okay. And then there's lack of motivation by the government. And this, we hope something will be done about it very soon. Next slide, please. So conclusion, I'll conclude here by thanking my colleagues in nurse anesthesia in Ghana for the tremendous work that we've done during this era of COVID. That despite these challenges and frustrations the profession faces, the nurse anesthetists remain resolute and committed in providing quality and efficient anesthesia care services in the health delivery service. This COVID era has exposed a lot of setbacks in our health delivery system, and the government is working on them. With the right medical equipment, sufficient logistics, maximum protection for healthcare providers, and better incentives for our nurse anesthetists, a lot of positive results will be achieved in this COVID era. Next slide. Thank you all for your attention. And this is Rich Hospital, one of our nurse anesthesia programs in Ghana. It's in Accra. It's a regional hospital. And I'm happy to have one of our colleagues, Sani. He's working in Saudi Arabia and he's joining us on Zoom. Thank you, Sani, for joining us. And thank you all for allowing me to be a part of this.
So thank you very much for giving us that talk. I hope you all have enjoyed hearing a story, especially for the ones who are from Kenya. We are used to talking to each other, and for the first time we are hearing from someone who is from another country. So I've seen in the chat box someone comment that in some regional hospitals in Ghana, that actually the nurse anesthetists give all forms of anesthesia as long as there's a surgeon to perform those surgeries. So I'm glad to hear that it's not only restricted to spinal, and some of them are able to even give GA and nerve blocks where possible, because I think the most important thing is access to safe surgery. So we will, I can see from our panel that our president has been able to join us. Alfred, are you there? Mr. Obengo?
Yes. Hello.
I told the team that,
Hello.
yes, you can hear me.
Yeah, I can hear you.
Yes, I had told the team that our president is doing presidential duties, so he had promised to join us as we go on. So I'll give you a few minutes to just welcome our attendees. Mr. Obengo is the president of the National Nurses Association of Kenya, and they are the ones who, as I said at the beginning, graciously provided this platform for us to have these webinars. So they've been very supportive, and we thought it's best for this global one to have our president with us. So Alfred, karibisha wageni wetu, as we say here.
Thank you so much. I want to apologize for coming in late. I also want to welcome each and everyone to this webinar conference. I think it's coming in at a very opportune time when we are celebrating the nurse and the midwife as declared by WHO. And we are also moving towards also empowering nurses as a nurse specialist. So this conference, I believe, will give us the necessary impetus to move towards empowering our nurses, and especially the nurse anesthetist. The information I have within the theater environment and our ICU department is that there's a lot of accolades that has been given to our nurse anesthetist, and I would wish that they continue with that performance. You are highly regarded. In fact, even the nurse, the anesthesiologist prefer you because they say you are hands-on insofar as handling of our patients is concerned. Moving forward, as we develop our scope of practice and refashion our scope of practice to reflect the true nurse of tomorrow as a nurse practitioner and a nurse clinician, I think this will go along the way also to empower the nurse anesthetists so that they can work more independently in their clinical environment. So with those few remarks, I wouldn't wish to take so much of your time. It has also been a very tough day for me down here in Kisumu, but we thank God all has ended well. So I wish everyone a successful time, and I am very hopeful that we'll enrich your intellectual intelligentsia as we proceed and we finish this webinar. Thank you so much. God bless you.
Thank you, Bwana President, for your time, and we look forward to engaging with you as you incorporate us into that overall scope of practice for all nurse practitioners in the country. So we'll move on to our next speaker. We have Jill Eloy Ribuka from Burundi. He is the president of the Burundi National Non-Physician Anesthetist Association, the Agora, and the second executive vice president of the African Society of Nurse and Technician Anesthetists. He is qualified in anesthesia and emergency critical care. and he represents his country in various specialties. In anesthesia, he works with the IFNA and WFSA to represent the interests of the anesthetists in Burundi. With regard to safer surgery, he works with Lifebox Foundation to make sure that they access some of the training programs that are offered through this foundation. And on critical care, he works with the World Federation of Critical Care Nurses. So Giles is a teacher. He has been involved in various training programs nationally, including safe anesthesia and obstetrics, pain management, trauma care, and the WHO checklist utilization. And he's also one of the youngest and members of the planning committee for PANAC. He is helping us represent the interest for people who are coming from Francophone countries. So Jill, welcome very much, and we look forward to hearing from you because yours is a unique experience. In Burundi, they do not necessarily have nurse anesthetists, but they are just acknowledged as non-physician anesthetists. So he'll share more about what they do in Burundi. So welcome.
Thank you very much. I want to check first. Can you hear me?
Yes, we can hear you.
Okay. Go to the first slide, please. I'm happy to be with you this evening, and good morning, good afternoon, or good evening, depending on the place where you are. I'm going to share a brief history of anesthesia of Burundi, how we deal with COVID-19 in Burundi in general, and what is the nurse or non-physician anesthesia providers, what you have done, and some recommendation regarding the anesthesia practice generally in Africa. First slide, please. As a bit of introduction, Burundi, officially, the Republic of Burundi, is a landlocked country, Lake region, and East Africa converge. On the map, you can see it's this small country in the middle of the continent. It is part of the East African community, where we have Burundi, Tanzania, Rwanda, Uganda, and Kenya. Gitega is the political capital city. Bujumbura is the economic capital city. And the country has 11 million people. 4 languages are spoken in Burundi. We have Kirundi, French, Swahili, and English. Next slide, please. As a brief history, during the colonization by the Belgians, before 1958, anesthesia was given by Belgian nuns, and from 1958, nurse anesthesia was initiated in Burundi by a Burundian who was trained by the Belgians. His name is Robert Kam, and he's actually with us, and he's in his Calvary. And in 1968, Robert Kam, he started an anesthesia course for paramedic students in high school of the 4th grade as a training. That was the first training which was made. And the Ministry of Health set up in 76 an accelerated anesthesia training for a period of 1 year to 15 months for 84 nurse anesthetists. They were employed the first in 1978, and 20 years later, in 1997, 61 were still active. Next slide, please. And between 1998 and 2003, in conjunction of the Ministry of Health, Robert Kam and Francois Ndarugirire, the first MDA physician anesthesiologist who came a bit later in the mid-18, early 19, they developed together an academic curriculum for nurse anesthetists. In 2003, the National Institute of Public Health, or as it is called, Institut National de Santé Publique in French. They started a 2-year program, and this resulted in an undergrad grade of A1 diploma, which may be called, or from Burundi or Kirundi speaking, candidature. In 2005, the Ministry of Health changed to a 4-year licensing degree named AO, equivalent to a baccalaureate of science degree. Next slide. By 2012, a new system was implemented, the BMD system, bachelor, master's, and doctorate. Don't get confused here. In Burundi, we just have the bachelor degree level only. We don't have yet a master's or a doctorate locally. And the anesthetist degree was a 3-year program for bachelor degree. And besides the National Institute of Public Health, 2 other universities have started to provide non-medical anesthesia training. It's the Hope Africa University in 2012. This university receives, even for many of the foreign students who come to study anesthesia in Burundi are found in Hope Africa University. And 2 years later, in 2014, the Mwaro University started an anesthesia program training. And in 2016, ATRAPS, the official organization of non-physician anesthetists, was founded and later became a member of the IFNA or IFNA. Next slide, please. As previously said, I'm going to develop on the criteria for anesthesia training in Burundi. As Gatwiri, it's a little bit different from other countries. We enter in anesthesia training directly from high school, but as you have noticed, in 1960s, 70s, 80s, the pioneer, Robert Kam, focused on those who were paramedics, and it carried on up to 2000, where the majority of those who were giving anesthesia were from this paramedical high school. But now things have changed. Now we have a high school certificate requirement for you to enter in any university at a bachelor degree level. So mainly we find a scientific section focusing on biochemistry and paramedical high school. And on top of that, you have to pass a national exam of high school certificate, and a minimum of grade of a half or 50% is required. Next slide, please. So now I'm going to discuss with you the Burundi experience of the pandemic in global. This table here highlights how the total cases we had, total cured, active cases, and the number of days. But this table is from September 6th. The news I got like area in this morning, things have changed a little bit, but I'm going to explain later. We had total cases of 466, and on the date of September 6th, we have 374 discharged, and we had 91 total active cases, and we had 1 death. Next slide, please. This graph shows how the pandemic was evolving in Burundi. We had our first case at the beginning of April. You can see it's the 13th week of the pandemic globally, and in red the new infections, and in green total of cured and discharged. As you can see, there was a variation of this trend. Next slide, please. This is a case breakdown in different regions of Burundi. By the way, I would like to emphasize on the fact that in Burundi, there was a campaign on which I'm going to speak later, a national campaign to test systematically everybody so that we can eradicate the COVID-19 pandemic as quick as possible. Next slide, please. So I'm going to give a context of what happened before we get to our first case in Burundi. So the context was what? First, when we had the virus in China, and then it migrated to Europe, when in it a lot of news circulating, so there was a lot of fear among us Burundians, I mean, and there was a lot of confusion, and there were misconceptions among anesthetists, professional anesthetists. For example, you would have somebody saying or someone saying that dark-skinned, melanated people can't catch COVID. So, and this was confusing at the time. So we had to, and it coincidentally happened when the Ministry of Health took an emergency meeting for the readiness to COVID-19 response. It was on mid-March 2020. Next slide, please. So the Agora, the National Association of Non-Physician Nurse Anesthetists, we contacted the Ministry of Health through official channels 3 days after they took this meeting for readiness of COVID, because there were some areas which were still unclear, which was not highlighting the role of the ones who would be like qualified to treat the worst case of COVID, of the official letter that we addressed to the ministry. It's called Déclaration à l'intention des anesthésistes réanimateurs intensivistes burundais sur les lignes directrices de l'anesthésie et les soins intensifs pour le COVID-19. It was a position statement to the intention of anesthetists, resuscitators, and intensivists who work in Burundi on how they could like behave during the COVID. Next slide, please. So we attached a position statement to the letter at the intention of all anesthesia providers in the country. So this statement was to dispel misconception and confusion and fear to offer a clear guide to the nature of the pandemic and the ways to how to deal with it. It included specificity to anesthesia, as we are going to see as an example. Next slide, please. So we proposed a simulation training module for general anesthesia for suspected COVID-19 cases, adapted from the vital anesthesia simulation training, the VAST, and it was emphasizing on sequence for donning and doffing of the PPE, general anesthesia planning, intubation checklist for suspected COVID-19, and a role play. This was in a document we offered to the Ministry of Health as a part of non-physician nurse anesthetists as to be ready to face the COVID-19. Next slide, please. This is a French slide highlighting the checklist for intubation, because the first time, this was before the first case was recorded in Burundi. And we were like, everybody was focusing on general anesthesia how to intubate, how to set up the machine. So as a proposition, we came up with a checklist for intubation. This was including like planning the team, the drugs, the equipment, and the PPE. And during intubation, how to optimize the patient, how to pre-oxygenate, and how to make a rapid sequence intubation that is modified. And post-intubation, how to deal with the airways and continuous care, and how to remove or doping the PPE. And we highlighted on things to avoid to do. But as the evidence showed up, we saw that those who were intubated tend to die earlier. So it was abandoned. Next slide, please. Meanwhile, we were working with our key partners, such as the World Federation of Societies of Anesthesiologists, the Association of Anesthetists, or AAGBI, as it was called, the World Anesthesia Society, and LifeWorks Foundation, and we were involved in providing feedback in the making of the draft work of the COVID-19 anesthesia checklist and trial flowchart. I'm talking about on a national level as an initiative from the non-physician anesthetists, and the making of COVID-19 surgical safety checklist made up by LifeWorks, SmartTrend, and WFSA. And nationally, we made another initiative where we looked for a donation of 200 parts oximeters in partnership with LifeWorks Foundation to support the national campaign. The national campaign is called I Get Better, I Do Not Get Infected, and I Do Not Infect. I'm going to highlight that the government was in need of 120 pulse oximeters, but we were able to get 200 pulse oximeters. Next slide, please. So as a conclusion, I'm going to try to answer this tricky question: how to build capacity for nurse anesthetists or non-physician anesthetists, mainly in Burundi and also in Africa, specifically. So sharing experience among nurse anesthetists and non-physician anesthetist providers. This is very important because as we see, I said in Burundi we have three schools or universities providing anesthesia training. But if you look into details, there are some differences in it. There is some gain or something you may find in one college you don't find in the other one. So that's why this point is very interesting. And drawing benefit from the best existing models of training and standardized training as much as possible. For example, if I take the US experience, starting in 2022, in 2 years, all the registering or SRNA are going to have a doctoral program, and starting 2025, all the new graduates, we have a doctorate level. And if you try to look in African countries, most of the countries, or in some areas, we still have ad hoc trainings, we have on-the-job trainings, and we have non-certifying programs below the bachelor degree. And some places we have the bachelor degrees as well, but few have masters, and very few. I doubt that there's a program that have a doctorate degree or program. So to draw benefit from the best existing models, as we are in a community of the IFNA, it will be very interesting to try to adapt from the best existing model. The other point is to create a training package available for providers. This is self-explanatory. And creating a training faculty database to provide training in country at request. This is from what we have been doing. The training package, I can say that, for example, the safe anesthesia training from education, the safe obstetrics and pediatrics. We can say the PTC module for training for trauma patients. We can say the EPM, the essential pain management, the safe OR, the VAST, the impact. That all these trainings, if we can like make them available, it can be better to build capacity for nurse anesthetists. And creating a training faculty database could be not only for locally, but regionally, on an African level. It could be very interesting. Next slide, please. And creating generic monitoring and evaluation system of training for providers of training to access this, together with creating generic quality control system for providers of training to access. This will make our programs very rigorous. They will give confidence to the providers and respect to our counterparts of the same job. I'm saying the MDAs. And offering continuous professional development program for those who have graduated, and providing training of trainers from these programs would be very interesting. And as I highlighted and focused on this point, starting graduating programs at least on the undergraduate level or postgraduate level, and even at the doctorate level. Next slide. Oh, I'm done. Merci beaucoup. Thank you very much. Asante sana.
Asante sana, Jill. I think it is good always to hear about other people's experiences. And I liked what you mentioned about building an international training faculty database, because I think that's very important, because that's one of the things that we hope to do as we hoped to do when we were conceiving the idea of PANAC. It's to bring us as Africans together to share experience and learn from each other, because I think that's the only way we can improve our practice, by learning about what other people are doing. So when you see who is doing it best, you can see what can I pick from Somaliland to bring to Kenya and improve the practice here. What can Somaliland send to Ghana for them to learn? What can we learn from Tunisia, from Burundi? I think by learning from each other, we grow our profession, and we are able to overcome the challenges that we face in our resource limited setting. So we'll move on to our next speaker. We are now coming home. So our next speaker is Mary Mungai. Mary Mungai is considered to be the mother of nurse anesthesia in Kenya. She's one of the first nurse anesthetists who are trained in Kenya, and she serves as the national patron for the Krna chapter. She has over 20 years of experience in nursing and anesthesia, and works for Kijabe Hospital. She runs the Krna program that is offered through the Kijabe College of Health Sciences, where she serves as the Director of Education for the program. She's currently the African representative on the executive board of IFNA, and she has been helping train not only Kenyans, but also anesthetists from other countries, including Somaliland, Ethiopia, and the US. She's also a champion for simulation training, which is relatively new in our country, but she has embraced that tool for training and is doing some very good work in Kijabe. So I'll invite Mary to share with us about the Kenyan experience. Thank you.
Thank you so much, Gatwiri. It's such a pleasure to meet each one of you. Welcome colleagues from other different parts of the world. It's already dark in Kenya. It's some minutes past 7. So we can hardly see what is happening outside because it's already dark. And It's such a great opportunity that we can meet together and share experiences of what is happening to each one of us, and even as far as our practice is concerned. Guys in Kenya, you bear me witness that we are excited to host such kind of webinar in our country, and to have other people from different countries join us, and we can share experiences and even learn together. For majority or most of us that are not coming from Kenya, Kenya is a lower middle income country, and we have a population of around 50 million. Our life expectancy currently stated to be allowed 68.9, I mean 67.5 years. And the most interesting part in our country is that majority of us are 75.1 of us are below 35 years. And you can imagine what that means. That all of us, a majority of us are very, very active. Majority of us are at childbearing age, healthcare. That would mean that the majority of us would need some surgery, and anesthesia is critical in our country. We can move to the next slide. Let's move to the next slide. So to highlight very briefly on healthcare system in Kenya, and it's structured in a stepwise manner so that people are seen in a very lower level of healthcare, and if they need something bigger than that which can be offered in such a level, then they are referred to a different level. And we have six levels, that is from level 1 to level 6 in our country, and the highest level is level 6, which we refer, and majority of level 5 handle all the uncomplicated cases, and they only refer if specialty expertise is required. This is because we have like 4 or 5 level 6 care hospitals in the country, and level 4 hospitals will do the most common emergencies like obstetrics and complicated laparotomies and hernias. And when it comes now to nurse anesthesia, you'll find a majority of them in level 4 and level 5 hospitals, meaning they'll do a lot of, they'll be involved in anesthetizing a lot of emergencies when it comes to laparotomies, cesarean sections, hernias, and such kind of cases. Them that are working in level 5 hospitals will do kind of more complicated cases, and them that are in level 6, there they'll find, they'll work with an anesthesiologist, and they'll do more complicated cases. So you will not find nurse anesthetists in lower levels where there are no theaters. Majority will be level 4, 5, and 6. Let's move to the next slide. Let's move to the next slide.
It's there.
When it comes to the health care workers, that is anesthesia caregivers, we have 3 countries in our country. That is, we have physicians, we have clinical officers, and when we refer to clinical officers, in our country, if you move to the Western countries like US, they are at a level of physician assistants. And then we have the third kanda, which is nurse anesthetists. Currently, in the register of Kenyan physician anesthesiologists, they have 201, and they have an additional 80 associate anesthesiologists. That is the ones, these are the ones that are already in training, but they have not like completed their master's degree. According to the information I got, we could have other physician anesthesiologists in the country, but they may not be registered in that register. But what we have currently is 201. From the clinical officer anesthetists, they have like 700 clinical officers that have been trained. And it's important to note that this is the oldest non-physician anesthetists training that has been in the country. And they have been ongoing, and the training is in various colleges in the country. When it comes to nurse anesthetists, we have 230 registered nurse anesthetists, and we have about 80 more that are in training, and a good number will graduate later in the year, and a good number could have graduated were it not for the COVID, but sooner or later they'll graduate and they'll be added in the register. The reason as to why maybe the nurse anesthetists are not many, we are going to see very quickly when the training got started and what is happening so far. Yes, we can move to the next slide. Nurse anesthesia training happened in a hospital called Kijabe. It's a non-government hospital. It's a mission hospital. And it started as an in-house training. And this was as a result of a gap that was observed in the hospital. The surgical volume was high, but anesthesia capacity was a big hindrance to enable the surgeries to continue. And this facility where the training got started is one of the busiest surgical units in the country. They conduct an average of 10,000 cases per year. It's a level 6B hospital. And it's a level 6B because it could be just level 6. And in this, from complicated to non-complicated and such. And with the time, with a lot of lobby through the licensing body and the other health institutions, the training was accredited in 2006 through the Nursing Council of Kenya. And currently we have 3 training institutions in the country. That is the Pioneer Institution, which is Kijabe College of Health Sciences through Kijabe Hospital. And also a Kisumu campus, which is under Kenya Medical Training College, and also a Kisii campus. The Kisumu program was started in 2016, while the Kisii program administered its first cohort in 2018. Nurses have been trained in these 3 programs with 230 Kenyans graduating from the program and still more in training. And as Gatweri mentioned there before, the program in Kenya has not only helped to train the Kenyans, but has extended a hand to our great neighbors, that is South Sudan and Somaliland. And for South Sudan, they have come to our country and have undertaken the training. Even currently, we have a few students from South Sudan. They train with us, and then after completion, they move back to their country to serve their countrymen. We also have our friends in Somaliland that have trained in their country. Some of us have moved there and assist them to train. And I'm proud to see Mubarak in this webinar, and he's one of our graduates. And they are doing a great job. Let's move on. So up to date, the nurse anesthesia in Kenya is guided by scope of practice that was launched back in 2018. And we are so proud that we are one of the first specialties to develop such a document. And nurse anesthetists in Kenya, as we had said before, we are members of National Nurses Association of Kenya, that is NAC, which is a member of international body of nurses in the whole world. And in 2015, we became a member of International Federation of Nurse Anesthetists. And currently, we have a Kenyan that is representing the continent in the executive board of the IFNA. And I think this is a great achievement, because we are not trying to practice in solitude, but we are joining up with the rest of the world and looking at what they are doing, and even comparing whatever we are practicing in our country, and we can tell that our practice is up to date when we observe what is happening in the IFNA. Let's move to the next slide. So for continuous medical education, nurse anesthetists in Kenya have a responsibility of continuing to develop themselves after training, but also as a KLNA chapter or nurse anesthetists chapter in this country, we host an annual meeting where all the graduates come together for 3 days. That is for lectures, workshops, and updates, and renewal of practicing license by our regulatory body is based on proof of CPD points earned as a result of continuous education. And PANAC is one of those meetings that we had planned to host this year, but due to COVID-19, we moved it to next year, 2021, God willing. And I believe that majority of us in Africa will plan to attend, so that we can continue to develop ourselves, because gaining knowledge, updating ourselves is the key element when it comes to our practice. The next slide, please. So what has been our contribution to COVID-19 management? As we may know, as in Kenya, we have registered more than 6,000 cases of positive COVID-19. We have also had a loss of more than 600 lives due to COVID-19. And also we have like more than 250 healthcare workers getting infected. And even nurse anesthetists have been among the team of healthcare workers that have been infected. We have been affected or had some cases of COVID-19. So we can't wish it away, but involved in is that we've been providing support for critical care units as needed during this pandemic. And in some countries, some of the nurse anesthetists has been a part and parcel of the COVID-19 response teams, working as a part of a multidisciplinary team. The chapter has continued since this pandemic to host webinar series to educate members, including oxygen therapy, IPC, considerations for surgery, as well as updates in resuscitation. And there was such an unfortunate incident because the first reported health worker mortality from COVID-19 was one of us, a nurse anesthetist. Let's move to the next slide. And as I have just mentioned, that continuous education is key to us, is very, very important, and we keep on encouraging each one of us to ensure that we stay updated and we get to know of what is happening in the world, the kind of practice that people are embracing. I just want to take this opportunity to welcome you officially to join us in PANAC. Conference, TUFA, it's very near. Kindly plan ahead. Sometimes as Kenyans, we learn when it is very late. But I would wish to encourage you. We enroll ourselves, we start saving money and sending it to the right place so that by June 2021, all of us will be able to come to Nairobi, and then we can apply IFNA and everybody else that is invited. Thank you so much. Asante.
So thank you, Mary, for those remarks. We are glad to share our story as the host of the first Pan-African conference, and we hope, as Mary said, you will all consider attending this event. So without much ado, I will introduce our final panelist. He is Donnell Carter, CRNA from the US. He practices in Boston. The last word is very hard for me to say with my African tongue, so he'll say it himself. He has been in practice for the past 13 years and has a bachelor in nursing from the University of That Hadley, Massachusetts, and a Master of Science in Anesthesia from Central Connecticut. Yes, that one university, and an MBA from Northern University. He's the he has served as the president of the
Massachusetts Association of Nurse Anesthetists.
From 2012 to 2013, and he's a part of the Boston African Anesthesia Collaborative, which works with anesthetists from Liberia to help them improve their anesthesia capacity to meet the surgical needs in Liberia. So we thought this is an interesting program for us to listen to, because the aim of PANAC is to build this kind of collaborations of for both South-South and North-South collaboration. So I'll welcome Donnell to share more about this North-South collaboration and how they're working together to improve access to anesthesia in Liberia. So welcome.
Thank you for the lovely introduction. Like I said, I'm Donnell Carter. It's interesting how you had a hard time pronouncing those names. And I look at some of your names, I'm like, Jeepers Creepers, let me just really take my time and try to figure this out in terms of how to pronounce it. It is an absolute pleasure for me to be here with you guys from across the nation, across the Atlantic rather. The time right now is 12:38 in the afternoon here in Boston, Massachusetts. My goal today is to talk about the Boston African Anesthesia collaboration, as well as the role of nurse anesthetists here in America as as we participate in the management of COVID-19 patients. And this should be a sort of an interesting twist to the overall mission of what PANIC is trying to achieve today. And that is the best practices across the continent and actually across the world. So let me just tell you a little bit about myself. I am native Black American. I was born in Boston, Massachusetts. However, I did get my DNA done, and I can claim 40% of my DNA resides in Nigeria. 18% of that is in Cameroon and Congo. 13% in Benin and Togo, 13% in Mali, 1% on the Ivory Coast, and 1% Senegal. So although America is my first home, I still belong to the motherland. Unfortunately, I don't have a direct linkage to my ancestors there because of the transatlantic slave trade. However, my every goal is to get over to Africa and to visit as many countries as possible. So far, I've been to Kigali, Rwanda, and that was mostly for work, and also Liberia. Both of those experiences occurred last year in 2019. I was supposed to join you guys at the PANIC meeting, but COVID had different plans for us all. And during that trip, I was going to try to get over to Tanzania to check out the beautiful beaches there. So, but at some point we will move to a higher plane, and I'll get back to my mission of visiting as many countries in Africa as possible, as well as hopefully meet you guys in future PANIC conferences and also IFNA activities too. So, just a quick talk about the current numbers here in the United States of America of COVID-19 cases. In fact, about 6,880,000 patients. We've surpassed the 200,000 mark at 202,379 deaths from COVID-19. So, although we're the #1 economy in the world, we also lead in the number of cases of COVID-19. Patients positive as well as death, which that's 23% and 21% respectively. Of course, we're still climbing and expecting a peak at some point in the fall, which we're about to experience within the next month. So I want to talk about the Boston African Anesthesia Collaborative. That is a collaboration between the Feed Paramedical School of Nursing Anesthesia, as well as Beth Israel Deaconess Medical Center. That is the hospital I currently work at. Boston Children's Hospital, which is a world-renowned facility for children, and Northeastern University, where a few of the faculty members who had the pleasure of traveling to Boston, spend some time at the university to get, an intensive in leadership, and as well as our faculty development. The Liberian Association of Nurse Anesthetists, the Liberian Board of Nursing and Midwifery, and of course the International Federation of Nurse Anesthetists all come together with the next slide, please. You can move to the next slide. Yeah. With the sole purpose of meeting the country's, you can back up, I'm sorry. Meeting the country's anesthesia needs. You know, of course, the World Health Organization has it in its mission to not only move Africa into, you know, a more leadership role in anesthesia, but also to increase access to safe surgery by way of anesthesia, because there cannot be safe surgery without anesthesia. So the role of the Boston African Anesthesia Collaboration is to partner with the leaders in anesthesia in Liberia to help them, you know, build capacity for their programs in order to meet the needs of the population there in Liberia. Next slide. You can move to the next slide. Yes. So, you know, some of the objectives are to increase the admittance of students by 40 per class, and to increase the workforce, which is, this is somewhat of old slides. I think the numbers is a little bit higher than that, but from the time that I did this, there's about 73 nurse anesthetists per, I think it's 4 million people in Liberia, to about 300 to 400 nurse anesthetists by 2021. Of course, you know, with COVID-19, unfortunately, that has sort of slowed things down, as, you know, ORs had to close down and such, as well as all the other facilities within the country. So they kind of put a sort of kind of slow things down. Next slide, please. Again, the mission is to address the dire shortage of anesthesia providers in the country. And, you know, right now, some of the things that they're facing is the limited ability to train nurse anesthetists, although, you know, the leaders there are currently working really hard to gain or to create the relationships among around the country's healthcare facilities, so that their students can have access to the operating rooms in order to meet their required case numbers, which is 250, to meet some of the requirement, meet the requirement of graduation there. Some of the issues also include a lack of quality faculty. You know, many of you, and I'm sure this, I've seen Aaron's on the call here. I'm sure a few Liberians might be on the call. There were literally 2 anesthesia schools in the country. One was started in about 1980, and now they're down to 1 as a result of a 20-year civil war, which resulted in a sort of destruction of the infrastructure, of the overall infrastructure of Liberia, which included the healthcare system, and obviously the schools of anesthesia fall under that too. The gentleman on the right-hand side in that picture right there, that's Mr. Wilmer Fossa, gentleman that I admire a lot, he is the current program director of the Phoebe School of Nurse Anesthesia. He is also one of the original nurse anesthetists that were trained under a woman that I'll speak about in just a minute. He has, a very amazing story, which I won't get into, but, I have to say he probably single-handedly kept this school afloat throughout the many, many years up to this point. And has been responsible for training a lot of nurse anesthetists, many of who are currently working in the country right now. Next slide, please. So again, there were 2 original schools. One was started in 1980 if you look at the gentleman to the right-hand side, that's Dr. Walter Guarnagali. He is a practicing surgeon in the country right now. And so the story of Phoebe kind of started with him. there wasn't a lot of emphasis on anesthesia in the country of Liberia at the time. So a lot of the surgeons were left to do their own anesthesia. And so he told me basically a story of how the FEEB school was started. And you know, it started because he had to do a surgery on a woman and ended up doing a spinal on her without necessarily having the skill set to do so. And unfortunately had an untoward result of that. And so he was married to a pediatric nurse from Puerto Rico, who he begged to go to anesthesia school and then ultimately come to Liberia to start a school there. So that's what she did. She got trained here in the United States of America and then, you know, began the FEEB School of Nurse Anesthesia. And basically, you know, through unsafe conditions because of the Civil War, kind of had to get out of there at the time. But that left Mr. Wilmer Foster to kind of handle things from that point on. So the school kind of progressed. Right now, it has level 2 IFNA recognition, you know, through 2024. But prior to that, and that process started probably around 2016, after the 2014 outbreak of Ebola, which Liberia was the epicenter of that unfortunate pandemic. So, you know, for a long time, their program the anesthesia training was reliant on sort of modules to, you know, train a nurse anesthetist, but that kind of model did not work for them at the time because, you know, when the foreign implementers of this model would leave, that would leave them with not necessarily the proper curriculum in place to continue to develop strong, safe nurse anesthetists in that country. So there was a move made by that woman right to the left of Dr. Guanacali is Dr. Eileen Stewart Shore. She's a nurse practitioner. She works in my department, but she's also a faculty instructor, a PhD at the University of Massachusetts, Boston. She does an extensive amount of work in Africa, Liberia, Swaziland, Eritrea. You know, she focused a lot on nurse practitioner in other countries, but she also did some work in Liberia through an organization that she used to work for, but no longer works for. And so after Liberia, she felt like, you know, she didn't want to leave the program floundering, so she began to build relationships to help support and build the proper infrastructure under that program to keep it sustained so that it can, you know, provide a solid basis to grow from. And part of that was to develop the right curriculum for the faculty to build the workforce. And that curriculum is based off the IFNA standards, and that's been adopted. Next slide, please. So, like I said, there's 400.5 million Liberians and counting, you know, there are about 73 or so practicing nurse anesthetists. Most of them practice in the capital of Monrovia. But of course, if you'll see a map. You can move to the next slide, please. Looking at the map here, Monrovia is on the furthest east coast of Liberia. There are many several counties that have sole practitioners, and you know, unlike some of what I heard a little earlier in terms of the numbers of nurse anesthetists and the percentage who are sole practitioners, I would almost say like almost 100% of the anesthesia that is provided in the country of Liberia is provided by the nurse anesthetist. And, you know, with one visiting physician anesthesiologist that practices in Monrovia. So as far as the role of the nurse anesthetists in the management of COVID, that is extremely important because, you know, they play a pivotal role in the healthcare system overall in Liberia. So there's a lot of leadership opportunity there, and you know, and the recognition of the nurse anesthetists is effectively being elevated by, you know, Mr. Wilmer Foster and Mr. Aaron Sona, who's actually on the call today too. And I want to say hi, Aaron. You know, these guys are effectively raising the recognition of anesthesia there at the moment. So right now it's a 24-month program. A completion of this program culminates into a diploma in nurse anesthesia. They're making they're making the necessary steps to move this into a bachelor's program. It currently has level 2 recognition from IFNA. As far as there's about 15 first-year students and 7 second-year students, and I think those probabilities are a little bit higher. You can move to the next slide. So some of the activities that have been implemented is, like I said, improved curriculum. They've already attained the recognition. It's all, you know, to build capacity and to strengthen the faculty and preceptor development. So one of, you know, this is very important because, you know, because of the 20-year Civil War and, you know, among other things, you know, the lack of resources, the lack of training, you know, there's an emphasis that we place on the faculty and the preceptors, you know, in that country, because through the preceptors and through a strong faculty and through a strong preceptor, you build strong practitioners. And so what we've done as the Boston African Anesthesia Collaborators, that we have sent for some faculty members to come here in America to train, you know, or to actually follow somebody like me in the operating room. And the goal was for the preceptors to follow me in the operating room as I am paired up with a student that we're training here in America in my operating room, so they can see how we train our students, and so they can take some of those tools and skill sets back with them and make it their own based on what they're able to do in that particular country. So that's our major focus right there, is on a faculty preceptor development. Thank you. So I had a chance to go to Liberia back in November of last year. And, you know, some of the things that we worked on together with the faculty there was the strengthening of the preoperative assessment, the MPO guidelines, the emergency algorithms, the airway algorithms, the pre-op pain management guidelines, the PACU handoffs, and pre-op hydration guidelines. And I actually had a chance to get into the operating room and basically show them how I practice, which was a you know, absolute wonderful experience for me. And I've learned a lot over there too. You can fast forward. All right, so this is a breakdown of some of the, you can back up one. This is the breakdown of the preceptor and faculty development. So that included a 4-week teaching abroad here in Boston, Massachusetts within our facility. So, you know, we wanted to, you know, we created the evidence-based classroom. They got a chance to get involved in some simulations, not only at Beth Israel Deaconess Medical Center, but also at Northeastern University. They followed us around the hospital to get clinical best practices. So they were in the operating rooms with us. They also spent time in the obstetric suite. They participated in our morbidity and mortality rounds and our grand rounds. And spent 2 weeks in the classroom at Northeastern University. And from, you know, as a result of the completion of that, they received a certificate in advanced anesthesia clinical education and brought that back to Liberia and implemented that back on Liberian soil. So you can fast forward one. You can actually you can fast forward again. And I already spoke about this too. So back up one. Back up one more. Okay, so while I was in Liberia, what we were able to develop was the transatlantic web conferencing. And so what that meant was, was that the Liberian nurse anesthetists, would present an interesting case that they had in an operating room. And they will present that to the nurse anesthetists here in America. And, we'll go back and forth and talk about some of the things that we could have, that could have happened during the case to improve the outcome of that particular case, based on the resources that Liberia has. And that was that's been a success. We were able to do a few of those before COVID. You could fast forward. All right, this little, you can back up one. All right, this little item right here was one of the things that they were able to take back from the experience here, and it was a sort of a portable handheld computer that it was loaded with a bunch of anesthesia books that they were able to carry around the operating room with them and have, used as a reference, as well as to study their material off of, and it was very helpful to them. You can fast forward. So what happened? So 2019, we're rolling along. We had this program going on very nicely, and then boom, we get smacked with COVID-19. So just like in Africa and across the world, everything shut down. The operating room shut down. The businesses shut down. We were pretty much relegated to our homes in an effort to contain this unfortunate outbreak at the moment. But even though what we were doing in terms of collaborative practice had to shut down temporarily, we shifted focus to what the role of the nurse anesthetist could be in this unfortunate pandemic. And the number one thing was a focus on the protection of the nurse anesthetist. And like I said before, Liberia was the epicenter of Ebola, so they already had a lot of protocol in place and was able to ramp up fairly quickly, in terms of social distancing, hand washing, things like that. They had that practice and already in place, so they were able to kind of roll along, pretty quickly. But the protection of the nurse anesthetist in Liberia was very important too, because number one, like I said before, there are only 70 or so nurse anesthetists in the country of 4.5 million people. So there's no room to lose anybody. And during the Ebola crisis, there was a loss of a nurse anesthetist during that time, unfortunately. So, the focus had to be on the protection of the nurse anesthetist, the student, as well as the patient and families of the patients, but also the families of the nurse anesthetists. So I'll talk about my role a little bit and how that played into what we were able to share with Liberia. We were, as nurse anesthetists, repurposed into other areas in the hospital as the elective surgeries came to a halt. So, and this is kind of different across America, but here in Boston, Massachusetts, here in my particular facility, the nurse anesthetists were put on ICU teams to help manage the COVID positive patients, as well as the airway emergency teams to help intubate COVID positive patients or any patients that were in a hospital that was suspected to be COVID positive patients. So our hospital was, very aggressive in developing, getting a lot of information from the world, because there were European countries that were already peaking and, and sharing a lot of information with the world, as well as the World Health Organization. And our facility were able to glean a lot of that information and develop protocols and guidelines to help us manage, first of all, to keep ourselves safe through the, the proper donning and doffing of PPE, but also to help us manage the workflow of the COVID-19 patients. So, some of the protocols we worked on were like, preoperative huddles, planned disconnect from, the patient from the circuit, intubation and extubation, screening and testing of patients, operating room workflow for positive and suspected patients, the workflow for L&D patients, obstetric patients, and also the setting up of the operating room to decrease contamination, not only within the operating room, but also throughout the entire hospital. And this was really important. This is, in terms of, decreasing, minimizing contamination, that was very important, particularly for Liberia. And I'm sure it's pretty important for a lot of the African countries because of the lack of resources that you have. So your resources are very precious. And so these were some of the things that we were able to share with Liberia. And Liberia, the Liberian nurse anesthetists took those protocols and made those protocols their own, and develop their own protocols based on their environment, based on their resources, based on their manpower throughout the entire country. So that sort of kind of gives you an overall view of the importance of the nurse anesthetist, not only in your respective countries, but I mean, the conversations that we're having between the PANAC nations is as important as the conversations that we have globally as nurse anesthetists, because globally we are leaders, you are leaders too. And together, we can be on the forefront of this, because we are on the forefront. In many of the countries, you are the sole providers. So it's increasingly important for your level of recognition to be recognized in the development of the right protocols and safety measures as we continue to deal with this pandemic. And so that's pretty much it. Like I said, I thank you guys for allowing me to be a part of this, and I am available for questions after this is over, and I'll stick my email in the chat just just in case you want to reach out to me. Thank you so much.
So thank you very much, Donnell, for sharing that brief on what you're doing with Liberia. I think it's very important to build capacity for medical education. I always tell the clinicians that I interact with that just because you're a clinician doesn't mean that you're a teacher. And sometimes it really helps to have that capacity building for mentorship, for to be trained as a teacher and a preceptor, so that you can improve your capacity to actually pass on information to your students, because every student is different, and with some of these skills you can actually take the time to learn everyone's learning needs and structure how you teach appropriately depending on who you're teaching. So I think there are some questions that are pending in the Q&A box, but I know we do not have much time left. We'd hoped to end by 8, and it's already a few minutes past. So I thank the panelists who've been answering questions as we go on. So what we can do is I will our email is at the bottom of your screens, info@krna.org. I will ask you all if you have any questions that you think were not answered during this presentation to please email us, and we'll make sure that you will get the responses that you need. There are people who've asked about master's program, what that entails in many countries, how people can get training without being physicians or nurses. So I trust that we can answer all this via email, and we will share the contacts of the panelists who presented today, of course, with their permission. For the nurses who are on this call, a CPD code will be sent to you on email next week. So please, please make sure that you send an email to us using the address that you used to register for this conference webinar. And if you want a certificate of attendance, send us your name as you'd want it to appear on the certificate. I know some people join in as Galaxy 101, so we can't know we can't tell your name with those nicknames that you use to log in. So please send us your name and we will prepare a certificate of attendance. So as all the panelists have mentioned, Kenya is the host of the Pan-African Nurse Anesthetists Conference, and it has been graciously, greatly, and I cannot underestimate the value that IFNA has had to make this conference possible. They gave us the chance, they put us in touch with various anesthetists across Africa, and we will not know some of you if it was not for this event. So IFNA has been a very invaluable door opener for us to get to know each other. We also have partners like Medica, Safe Anesthesia Worldwide, Vanderbilt University Medical Center, the Africa Mission Healthcare, of course our hosts, the National Nurses Association of Kenya, and also the Burundi Association of Anesthetists, who've worked with us to make these webinars and this conference possible. So we hope to see you all in 2021. Keep in touch with us. You have our emails. You can visit the conference website. It's www.panac.africa, which is very easy to remember. You just need to remember Panac and Africa. So we look forward to more of your questions, and I thank the panelists for their time. I think the comments I see in the chat box are very positive. I think this has been a very informative session. So I'll ask everybody to take the challenge that Dr. Jackie gave us at the beginning, to take up that leadership role and advocate on behalf of non-physician anesthetists, and keep seeking to improve yourselves in terms of your practice, because learning should never stop. So please keep in touch with us, and thank you.